Every student that is trained in our MPH program, regardless of the concentration, whether it be health promotion, environmental health, EPI, or disaster management, has to demonstrate at the end of this training that they've accomplished certain competencies, certain skills, and certain knowledge. And the way we demonstrate that is in a capstone project. So they do a final project that reflects and shows us that they have the skills, they have the knowledge, they have the abilities that we've been training them throughout the program to then move out in the field and be able to perform these tasks as a public health professional. The poster day is a way of demonstrating that, and every student needs to develop a poster that summarizes their capstone, their final experience. And this is an opportunity for them to be able to explain that to faculty and visitors that we invite to this. And we try to make a big event out of it, make it something that's fun. So we'll bring everybody together, we'll bring the faculty together and allow them to, in a little bit more informal atmosphere, explain this big project that they've been spending their entire semester, ultimately maybe their entire time here on, because they're building the skills to do this particular project.
My capstone was an analysis of service utilization of refugees in Georgia, and I found gaps in their ability to access services that would help them acclimate more and become more successful. And I made recommendations for practitioners and for policy in order to address these gaps that I found. Transportation is a huge issue. Clarkston, Georgia is where a lot of refugees in Georgia live. And people say that they chose it because it has access to MARTA and a bus system, which is true, but a study at Georgia Tech found that it's a really unreliable transportation system, and that if you don't speak English as well, it makes it extremely hard to navigate. And then translation is a huge issue. The inability to communicate is really a hindrance, probably one of the biggest, because a lot of service providers offer services to refugees, and most of the time of lower free costs, but they also don't have the ability to pay for translation services. And then childcare is huge. There's very little childcare assistance in Georgia, and you have to be pretty low on the income level. And when they get a certain amount of cash assistance when they first get here, and eventually when they start making $10 an hour or so at the factories they work at, it puts them a little bit over that income level. And so it's hard because a lot of women specifically don't take jobs or don't try and get jobs because they know that they wouldn't have anyone to take care of their children. For the transportation issue, I think that it would be a good idea if some organization tried to start a program where refugees that do speak English, they're integrated into the public transportation system, and they can be the ones driving these bus routes. Translation, there are lines that businesses can pay monthly fees for where they can call at any time and get connected to a translator. And I think that should be more of a priority in terms of where funds should be channeled for nonprofits and for-profit businesses and medical services in the Atlanta area. And then childcare. So it's easier to do something on a smaller level than a policy level, as we know. And so besides changing policy, I think that some type of program for refugee women to be trained in how to get a small business license and start daycares or childcare services in their homes and their apartments, so that people in their apartment complexes, their communities, can pay a small culturally relevant fee to them to watch their children while they work, and they're also making an income and they're starting small businesses in these communities. Would be a really realistic way to bridge that gap of childcare and get more women and families into jobs. I am moving to New York City to become a social worker, and I'm going to be doing preventative casework to keep families together that are at risk for being broken up or having their kids taken away.
The subject was around children and obesity and culture. So around the U.S., obesity still continues to be a pressing issue for children, and especially for children in minority populations. 21.9% of Hispanic American children and 19.5% of African American children have obesity in 2014, compared to 17% of children overall and 14.7% of white children. And a lot of programs have been developed to address the problem as a whole, tackling physical activity, nutrition, and other aspects of weight management, but very few have been focused on culture specifically, even though it has been shown that culturally adapted interventions can be twice as effective as a regular intervention. So the goal of my research here was to look at intervention research and descriptive research and just draw out some lessons and strategies for how to best culturally adapt an intervention for children. I went through a literature review. I searched on topics such as cultural sensitivity, children, weight management, a whole host of other wordings. And from that, I drew out certain weaknesses that exist both on the family level at the small scale and on the larger level within schools and communities that are culturally linked. And I also built up some recommendations that tie into those weaknesses. So for example, one of the biggest things is to have both children and parents actively involved in the process. When it comes to children, we often just consider them the end product of the intervention and just throw information at them, when we should actually be including them within the development of the intervention itself and soliciting their feedback when it comes to positive and negative health behaviors, cultural preferences, and even just personal preferences. And we should also have them be actively involved in the intervention rather than just receiving information. So for example, a community gardening project would be a great path because it incorporates physical activity, it incorporates education about nutrition, it gives children a chance to practice those things, and it also gives them a chance to be deeply involved with their community, which can give them feedback and help foster those positive behaviors. Moving forward, I hope to hopefully continue on public health efforts revolving around children and their needs. I'm currently finished up my internship at Safe Kids Georgia, which focuses on unintentional injury prevention. I might end up working there in the future, or I'm also a finalist within the Presidential Management Fellowship Program, so I might be able to find a position through that and further my interests that way.
So basically, my project is on the applications of unmanned aerial vehicles, which is also known as drones. I chose this topic because there's a lot of negative connotations surrounding the use of drones because of its military use in war and drone strikes and such, and so I wanted to bring to light its good intentions, especially in emergency management situations. So what I did was I took the Department of Homeland Security national planning scenarios and then did different applications of the UAVs and see how the UAV could be used in those situations. As you can see, reconnaissance and mapping is something that could be used in every single scenario. And then the first scenario, which is a nuclear planning scenario, it can use all of the applications. And so I just went through each scenario, thought about what the UAV could be used for, and then pretty much compiled it in this chart. This is really good for surveillance. The camera has like very, very good quality, and you can do live streaming. I know that the Georgia Emergency Management Agency and Homeland Security is using it. And then other law enforcement, like local law enforcement, I know here in Athens, Clark County, the emergency management, Beth Burgess is using this. And so a lot of law enforcement is using it. And it's just beneficial in terms of surveillance and helping identify things in the community. I would like to work for the state or the federal government eventually, doing emergency management and preparedness stuff. Or I would like to work in a campus setting doing campus security and like preparedness.
I worked with Dr. Callens on prenatal health care in Liberia. We were looking at the role of family functioning on depressive symptomology in pregnant women. So we thought that higher functioning families, women will have less severe depressive symptomology and less severe exposure to stressful life events, which in turn will help them mitigate the risk for depression. Women in low-income post-conflict countries like Liberia are at a heightened risk for depression. The statistic is around 15.6% of women in those types of countries have depression, to suffer from depression. So we wanted to kind of look at the role of the family and how that could impact depression rates and see if that could lower depression in pregnant women in those situations. Family functioning just means how well your family gets along. If you are stressed at work, is your family supportive? Do you have an overburdened amount of housework to do? Are they supportive in that? Are they helping? Are arguments long going, or are they quickly resolved? So those types of situations can either put a woman at risk for depression or kind of ease the tension and lower her stress level so that depression isn't a risk factor. Dr. Callens actually went to Liberia in March of 2016 and collected data from pregnant women in a local health clinic there. We had around 195 women participate in the survey, and from there we looked at family functioning, stressful life events, and depressive symptomology, and kind of assessed whether or not the family functioning did have a relationship with the depressive symptoms. So overall, we found that when women have higher family functioning, when things are good at home, they have less severe depressive symptoms and they have less severe exposure to stressful life events. So moving forward with that, it's important to know that depression in low-income countries does happen and that women are at risk for postpartum depression. And screening women at the time of care for those risk factors for depression is important, and creating programs that foster family functioning, family support are really important in order to help women avoid that risk for depression. Moving forward, I'd love to keep working in women's health, maternal health, maybe in a clinical setting or just working within the community, trying to use family functioning as kind of the grounds to work through pregnancy and have a better life.
My capstone was about LatinX immigration and commonly held misconceptions. It was more inspired by all the rhetoric that's going on right now. I first did a literature review looking at the history, and then I applied that to a classroom module where the students took a pre-test and a post-test to determine how applying these facts changed their perception of the commonly held myths. I worked with Dr. Pamela Orpinas in her diversity and social justice and public health class. Just sampled everyone in the class, and they took a pre-test online in their first class period of the semester. And then once this was discussed in the class, it was about midway through the semester, then they took the post-test to determine the change, if there was any change in between their perceptions at the beginning and at the end. And it turns out there was a decent amount of change in perceptions, especially in regards to whether or not they thought that undocumented immigrants pay taxes. A couple other myths are like that we don't need them and they're taking our jobs. And as far as that we don't need them, we have a largely aging workforce. It's a big issue, and they're taking our jobs. There's been studies done that show people, native-born Americans versus foreign-born, have the same level of education. They seek different jobs. So they're not taking jobs, they're taking different jobs. There's not really facts involved in the argument. It's all gut feeling, and like, I don't like them because of one anecdote I heard. And adding facts that can't really be disputed, it adds a different dimension to the discussion. Misperceptions like this, they affect people in the Latino community, and they may be victims of sometimes discrimination and prejudice, which is going to affect all aspects of their health, their maybe ability to access health care, ability to get a job or seek even just get food. I would like to work with either a nonprofit or at the government level with the Latino population.
My capstone is about school nutrition policy and state obesity rates, and I worked with Dr. Thapa on it, and basically what we did is that we took state policy laws from the CDC's chronic state policy tracking system, which basically is like a system that has all types of laws in it, and categorized those. And then my part of the project is that I took the laws from 2003 to 2011, and those are all childhood obesity laws. And then the goal was to run a regression analysis to see if state obesity laws had any effect on obesity and overweight rates. So the most was for childhood obesity rates. So what we found is that the higher the amount of state policies were in the state, the higher the obesity rate. Very against the logic. And then the lag variables were also significant, but that just basically means that the rates from 2003 affected 2007 and then 2011. This is a very actually new type of research. There's not a lot, so it's very limited. And the problem with obesity is that it's very complex. So it's very hard to measure where our laws are having an effect on obesity rates, because obesity is affected by psychological factors, by the built environment. There's some genetics in there too. So it would take mediation. It's like a new type of statistics tool where it's able to take like different like factors and then be able to do like a statistical analysis. So it would take a lot more to have like an even more accurate effect, to study this accurate effect of it. We have so many laws coming out, so many policies in the state, in the schools, in the workplace, but really we don't have anything that's saying, is it really having the effect that we want it to have? So we need it to be able to get more efficient and, I mean, at the end of the day, be able to help the health of the whole public. After graduation, I will be pursuing a PhD, most likely in epidemiology or in health policy and management.
I used an in vitro model, which means I used some cells instead of exposing live animals, to a pesticide called diazinon. I used some fat cells that were actually pre-fat cells before they differentiated to have fat in them. Diazinon is still used on farms and agriculturally, but not residentially anymore. But some people still have it in their house, so there's still a good bit of exposure in the population. And there's been some previous research to suggest that there may be environmental factors at play to obesity, which is an increasing problem throughout the world, besides just nutrition and exercise. I took these cells and treated them with doses of diazinon at pretty low levels before it would cause any obvious huge toxic effects where you would seek medical attention. I found that with just treatment of diazinon and not your typical hormones that cause you to produce fat, that they produced fat. Both visually, we stained them and you could see the lipids, but then also we looked at some genetic and protein markers where over time and with an increase in time and an increase in dose, the proteins associated with fat cell production increased. So this overall suggests that there's environmental factors at play, which should be addressed when we're looking at how to decrease obesity throughout the United States. It's possible that people are being exposed to this chemical at low levels, that they're not otherwise seeing any symptoms, either in their homes, or if they work in an industry where they're exposed to pesticides, or possibly maybe it could still be on their produce. Along with the factors of obesity, this could be disrupting hormones and normal biological processes, causing them to increase their fat cell production. And then thus, when there's increased obesity, you also have an increased rate of heart disease, diabetes, and other issues that could cause morbidity and mortality. I will be attending Mercer University for medical school in the fall.